Hi, my name is Dr. Ryan Kunstadt. I'm an endocrinologist with Holy Cross Hospital. I practice in Coral Springs, Florida, and I also have an office location in Fort Lauderdale as well. I'm very excited for you all to be here today. The topic of my presentation is diabetes and COVID, understanding your risk and optimizing medical management. Feel free to please submit questions during my presentation. Like I said, I practice in Coral Springs and Fort Lauderdale, and in terms of what patients I see in regards to endocrinology, I practice general endocrinology, so the majority of my patients are I see a lot of diabetics, I see a lot of patients for thyroid disease, as well as many other endocrine conditions, including adrenal disease, pituitary disease, male and female reproductive hormones. So those are some of the areas that I see patients in commonly. I also have a certification through the American Academy of Clinical Endocrinologists for thyroid ultrasounds and thyroid nodule biopsies. So I have, in my Coral Springs location, I have dedicated time during the week for diagnostic ultrasounds and performing fine needle aspirations for patients with nodules. So I'm very excited to have this presentation today. It's very applicable to what's going on in the country and around the world. Diabetes. So I just wanted to give an overview of what I will be discussing today. The first area which I will be discussing is the diabetes and the impact on COVID. And I wanted to emphasize the risk of developing COVID with diabetes. The second area which I will be discussing is living during the COVID-19 pandemic with diabetes, but not necessarily having the COVID infection. And finally, the last area which I'm going to discuss is if, unfortunately, you were to develop COVID-19 and you have diabetes, how do we manage that? So the first area which I will be discussing is the impact of diabetes on COVID, so that we are learning more and more about this disease over the past few months, and the treatment has changed and evolved. In terms of the relationship between the two, there does appear to be increased inflammatory proteins, or what are called cytokines, that are more prevalent when patients' blood sugars are higher. And so those higher cytokines, inflammatory markers, can cause tissue damage, and they can cause different organ damage from the lungs to many different organ systems, which can lead to different severities of the infection. And then secondly, there's another possible interplay where when a patient has higher blood sugars, that may impact a certain enzyme in the body, and ultimately this could facilitate entry of the virus into certain cells, which can predispose patients to the COVID-19 infection. So in terms of the next thing I want to talk about is the risk of COVID-19 and diabetes. So we know that patients that have diabetes are at much higher risk of the COVID-19 infection. And again, we're learning more and more about this over time. It does seem to be that patients that have poor diabetes control tend to have increased risk of developing the infection and also a more severe infection. So that's one important risk factor for COVID-19. So what we believe is that the more medical problems a patient has, the risk is higher for the infection and mortality. So these are conditions like lung disease, heart disease, kidney disease, someone that's immunocompromised. So those may be patients that are being treated for cancer, that have a history of having a transplant. So those different conditions all impact the virus, impact your risk of developing the virus, and unfortunately may increase the risk of mortality. So the next part of my discussion is discussing living with COVID-19 living with diabetes during the COVID-19 pandemic. So for the majority of people, most people are not going to have develop the infection. So the question becomes, how do we best manage our diabetes during this pandemic? And so, as I mentioned before, the diabetes, if your diabetes is poorly controlled, you have higher blood sugars, that may increase the risk of the infection. So what we really need to do as patients is making sure our diabetes is best controlled as possible. And so diabetes is a whole spectrum, from patients that are just on oral medications to insulin, and then there's type 1s are just on insulin. So as a diabetic, whether that's type 1 or type 2, the best thing you can do for yourself is making sure that your blood sugars are controlled. So for patients that are type 1 or type 2 that are insulin dependent, making sure that you're up to date with checking your blood sugars frequently, maybe even more frequently. This is the time where another reason to take charge of your health. And if you're not on insulin, many patients are not on insulin, they're just on oral medications. So for those patients, you probably are checking your blood sugars at home. You may want to check your blood sugars a little bit more frequently if you're at home during this time. And our job as patients and providers is making sure your blood sugars are controlled. So if you're having difficulties with controlling your blood sugar, you need to be having this discussion with your primary care physician, whether most providers are either providing telehealth services or seeing patients in the office. So this is a time to keep track of your blood sugars, take charge of your health, making sure you're on the right medications, making sure you're on the right dose of insulin. And the next thing I wanted to discuss was making sure you're physically active during this time. So I have had, unfortunately, a lot of patients that says it's they're more sedentary, they don't feel comfortable going out, and there are opportunities to still be physically active even though you may be at home. So this can be doing workout videos online. You can find lots of different things on YouTube, including Pilates, yoga, ballet. You can go into the ocean to go swimming. Those are all different activities that can help control your blood sugars, and you will notice that your diabetes will probably be better controlled if you're being more physically active. Lastly, you want to make sure you're up to date on your immunizations, having your routine cancer screening with your doctors. So just making sure you're healthy during this time period. Finally, in terms of the last area which I wanted to focus in on was for the patients that do get the COVID-19 infection and have diabetes, and how you manage this. So what we've seen is that there's a whole spectrum of patients of COVID severity. Some people are able to manage safely at home. Some patients are going to need more closer supervision. They're going to need to be seen in the hospital. They may need oxygen therapy. So the first thing is if you do develop infection, kind of knowing where you are on the spectrum. If this is something that you can safely manage at home, be in close communication with your doctor. If things were to get worse, then you would want to present to the emergency room or let your doctor know that you're in the hospital. And so for the patients that can take care of for the patients that can be safely treated at home with COVID, you want to continue your medications. What's really important is that you make sure you stay well hydrated. As with any infection, there's a risk of dehydration, kidney injury. So if you're not nauseous and throwing up, you should continue your medications. However, if you are having difficulty taking any food down or your pills down, then it's okay to hold your medications. But you want to be making sure that you're checking your blood sugar regularly. If you feel that your blood sugars are higher than they have been, and there is risk of having higher blood sugars with the infection, you need to let your doctor know, and insulin may need to be adjusted. You may need to go to the hospital. So those are things you do want to make sure you're checking your blood sugar more frequently if you're at home with the virus, because there's risk of things getting out of control. And then for the patients that are not able to manage this at home, whether their oxygen levels are low, they're feeling really ill, they can't keep fluids down. Those patients are going to be in the hospital, and you're going to have a team of doctors that will be caring for you, and that generally is a general internal medicine doctor, and it may be a specialist like an endocrinologist. And so typically in the hospital, we tend to hold the oral diabetes medications and tend to give insulin. Sometimes it's as needed insulin. Sometimes it's scheduled insulin. For patients, some patients, you may notice that if you were to unfortunately come in the hospital, and you were on oral medications before, sometimes you're on insulin for a short period of time. And as I've said before, the therapy for COVID has evolved over the past few months. And as of more recently, we've been giving more and more steroids to patients in the hospital. And so steroids can negatively impact your blood sugars. And for patients that are on insulin, their requirements may increase, or for someone not on insulin, they may need insulin for the first time. So those are things to keep in mind. And then the last thing, we have seen this, and there's literature on this too, about patients that never had diabetes before and that end up in the hospital with the virus and have new onset diabetes. So that's a recognized thing that we've seen as of recently. So I'm very happy that you could join me today. I just wanted to give you my office locations. Again, I practice mostly in Coral Springs. My office address for that location is 2901 Coral Hills Drive, and it's Coral Springs, Florida 33065. And the phone number is 954-753-0500. And then my other location is in Fort Lauderdale near Holy Cross Hospital. And the address for that is 5601 North Dixie Highway. And the city's Oakland Park, Florida 33334. And the office number for that is 954-491-2140. And the office number for the Coral Springs is 954-753-0500. And now we're going to open up to questions if there's any questions that came in.
We do have a couple. First, you mentioned frequently checking your blood sugar levels. How frequent is frequent enough?
Yeah. So the question that was asked by our viewer was, how frequently should we monitor our blood sugars? And was this regarding if you were to get the infection?
Either
okay.
Case.
So this is a common question I get, and it's going to vary by patient. So it depends on your control. Some patients are just on oral medications and can be. So let's take the situation where someone doesn't have any virus, and we need to know how often to check their blood sugar. So what I tell patients is, in terms of the importance of checking your blood sugars, is it allows us to know where you stand on a day-by-day basis between your labs. So you may be checking labs every 3 to 6 months with your doctor. So at least it gives you some motivation to know where your blood sugars are, how your diet's impacting your blood sugars. Is your diabetes managed well on the medications that you're on between your lab visits? And that's important. And so that's for the patients that are on oral medications. For patients on insulin, not with COVID, so we need, typically some patients are on 1 shot of insulin a day. Some patients are on as many as 4 or 5 shots a day. So it depends on how many shots of insulin you are on a day. Some patients that are on 1 shot a day may be able to get by with checking their blood sugars maybe twice a day, but patients that are on more insulin injections may need to be checking their blood sugars, at least 3 to 4 times per day. In the situation of someone with the infection, there's not a specific exact number about how many times that you should be checking your blood sugar. I just would caution you to say we know that with any virus like the COVID-19 virus, that your blood sugars may tend to increase with the infection. So I would say probably an extra once or twice per day, whether you're on the oral medications, if you're checking once before, maybe 2 or 3 times a day, and then if you're on multiple insulin shots, maybe as much as 5 or 6 times a day. So because things can get out of hand quickly. So
And will I always need medications or insulin once I'm diagnosed?
So the question is, and this is again, the question was regarding not necessarily COVID, but just
Diabetes.
Okay. So the question was regarding management of diabetes, not in the setting of COVID-19, but do I always need to be on oral medications or insulin? So this is, again, something I see every day, and it's a question, and it's very individualized. So some patients, and again, a lot of this plays into patient by patient basis, but some patients that come in that may be very overweight or obese, that are eating a lot of the wrong foods or drinking a lot of sugary beverages, they may get started on a lot of oral medications, they may get started on a lot of insulin, and some of those patients make drastic changes to their lifestyle. They cut a lot of the sugary soda beverages out, they reduce their sweet consumption, and their blood sugars improve dramatically, and they're able to come off their medications, or come off oral medications, or actually decrease or stop their insulin. Some patients make a lot of these changes, and unfortunately sometimes they still need to continue the oral medications, or they still need to be on a significant insulin dose. So it's very individualized, and it's kind of a patient by patient answer, and that's something that an endocrinologist could help you with, or a primary doctor.
Okay. And then we have one last question. How do other factors such as high cholesterol and high blood pressure affect me if I have diabetes?
So the question was, how does high cholesterol and high blood pressure impact diabetes? So we know, for diabetes, we always want to get as best control of your blood sugars as we can, because we know that the better controlled your blood sugars are long term, we can prevent a lot of the complications from diabetes. So these include kidney disease, they can include problems with something called retinopathy, where you have visual problems that can be permanent. And so it's similar in a way to the COVID-19 infection. If we can decrease these risks, so if we can decrease if you can decrease your blood sugars and having you at optimal control, if we can have your blood pressure well controlled, and we can have your cholesterol well controlled, the idea is that hopefully if all these different conditions are controlled, we can reduce the risk of future problems down the road. So for high blood pressure, if you have high blood pressure and you have diabetes, which are so common, controlling the blood pressure can prevent kidney complications, as well as other, as well as heart conditions. And so it's really important to kind of individualize all these different comorbidities, these medical problems, and try to control them in an optimal manner to prevent long-term implications from these diseases. So thank you again for everybody joining today, and I hope that I helped you with your education on this subject.